What's up, everyone? Welcome. I hope you all are doing well. Hope your week's going well. And I hope you guys enjoyed Monday's presentation. Usually that's like the one where people start to put the pieces together. So do you guys have any questions or anything you wanted to hit right off the bat? Um, I wanted to talk about something, but I'll wait until you guys have any initial questions.
Well, Connor, a few of your, I've seen one of the videos, and I think in when you're doing the explanation of the hip shift, when you're pulling and pushing, is your rear foot against the wall behind you?
Which exercise are you referring to specifically?
So doing a split stance, split squat, or like a lunge stance, doing the single leg squat. I think I've seen it was one of your other videos where you're doing it was the cardio, doing the amount of exercise until your form falls down.
Yeah.
But you had them doing it with a heel reference on the rear leg. Is that a thing? Is that just because more points of contact helps you sensing it?
Yeah, I think it's both. So I think when you have a foot up against the wall and you're pressing into something like this, right? Like I usually cue a sense of the arch on that wall, which helps you push into this stance leg, which helps you get the single leg stance muscles. You can get right glute on the back. And then I got left adductor, left glute med. If I didn't have that, I find it's just a little bit difficult to sense those things. But if you push into it, it's a lot easier to find those single leg stance muscles.
Cool.
Mm-hmm.
Hey, Connor.
What's up?
Okay, I got a few questions. So I had like a pretty big light bulb moment this morning with the ISA stuff, which was like a few weeks back, but I feel like it's finally starting to click. But I had a few questions about it. First one, I asked, why is a narrow considered expanded and why is a wide considered compressed? Because to me, it seems like the opposite. But I know it's relative. I think I kind of worked it out in my head. I think you could make the argument that they're both expanded and both compressed, just depending on what direction you look at it. So what's the general consensus that you're thinking about when you're saying that?
I think there's a couple of things that go into it. That's a really, really good question. And I think the reason why we call wides compressed and narrows expanded is because when we think of someone who's usually wide, we think of a male who's, bigger, powerlifting type of individual. So I think just in terms of like labels we put on people, I think the idea of someone who's compressed is someone who's bigger and has a lot of tone, has a lot of musculature. So I think that's just kind of almost just like a societal thing in a sense of just like you are compressed because you're like a big, strong dude. I think that's how it got that label originally, but ultimately I think it's also like a pelvic position thing because like the wides have a compressed pelvis because they're biased towards internal rotation, adduction, and extension. Like that's just what their bodies should have. And also I think that's a rib cage thing too. Their rib cage should have access to those joint mechanics too. So if they don't have that, then that's a compensation, but they should be there. So we call that compression in week one. So that's why we call those people compressed. But I can totally see where you're coming from. And narrows, yeah, you're right. It's just where are they compressed, where are they expanded? It's just the opposite for both.
And then, sorry, I just had a part two to that, Amy, if you don't mind. Okay. So, and I said, is abduction a test for expansion because it's moving away from the body? Can you explain to me why is external rotation a test for posterior expansion and how is IR more anterior?
The reason why it's about where the compression is located for IR. So pull your shoulders together right now, go into the IR test position and try to do it. It feels terrible. It feels really, really terrible. So what this IR is measuring is where your humerus is. So if I've got a humerus that's already biased and a scap that's already pulled into internal rotation, then you're going to have a really hard time further internally rotating because everything is pulled forward and then this humerus translates backwards, and then it's basically stuck and it impinges within the glenoid fossa. And also the ribs here can't expand. If they could expand, the shoulder would be in a better position to internally rotate. Now for external rotation, squeeze your scaps together really hard and then try and externally rotate. You get stuck because you have the compression back there, but then internal rotation feels much easier because you've expanded this, but you have basically compressed that T5, T7 region posteriorly. And Zach Couples goes into some stuff about the orientation of the rotator cuff muscle fibers and how that plays into it. I don't know if you guys have seen that video, but he basically describes the oblique orientation of some of the rotator cuff muscles if they're concentrically oriented. And if you drew a line from here all the way down, then you would basically be along the same orientation of the fibers. So if they're concentric, you're not going to be able to access that range of motion.
That's in the All About the Ribcage podcast.
I believe so, yeah.
I've listened to that 7 times. I'm just like still trying to wrap my mind around it. Okay, and then my last question, I promise everybody, is can you explain the wide, narrow ISA strategies? So I'm confused how, like, when we say a wide ISA is an exhalation strategy and a narrow ISA is an inhalation strategy. I just need to like that to be cleared up for me.
Yeah. So again, I think this is like a pelvis thing more, and it's like how they're trying to exhale is another thing too. So we start off, our diaphragm should descend, our diaphragm should ascend upon exhalation, but it can't do that in both cases. It's just a little bit different for both. So a wide is going to have a representative IPA that's similar to their ISA. So wide has a bunch of air basically trapped within their abdomen specifically, and also the anterior rib cage. So they're trying to exhale by doing this. They're trying to squeeze the air out like that, but they can't necessarily do that very effectively. So their pelvis also goes into an exhaled state like so, which raises the pelvic floor and prevents air from going down and expanding the pelvic floor. It's like a trampoline, it's just gonna bounce. The narrow is here, they're in an inhaled state because their thorax, they're trying to exhale by doing this. They're just trying to get all this out like so, which opens up the back, but also their pelvis is going to go into an inhaled state so that they can get air to go down as well. So air just can't go into certain areas respective to each ISA. It's just different as to where. And this goes into your other question of like, where are they compressed? Where are they expanded? It's just different. So narrows can drop air down and back, and wides can shoot air forward and up.
Thanks.
Mm-hmm. I think the Alex Effer also goes into the idea of like, if you look at the diaphragm strategy, and I'm going to have to remember this correctly, the diaphragm strategy and how air is being managed well within the pelvic floor, I believe he says the wides because they have a very, basically like they have this trampoline going on. They shoot air down here into their posterior pelvic floor and up like this, whereas narrows do the opposite. They're here, so they shoot air into their anterior pelvic floor and also posteriorly. So it's like this zigzag pattern, like so.
I have just a quick question. When you said weight room principles, we want alternating action. And yes, we do want alternating action. Is it because we want whatever we are doing in the weight room to be as closely closely resemble the gait cycle, the body's natural primary locomotion strategy?
Yeah, I think that's a big part of it. And also I think a big part of it is the body was meant to expand one side and compress the other and do the opposite thing on one side and the opposing action on the other side. So what you're doing with an alternating action is exactly that. You're compressing one side and expanding the other. And in that powerlifting ebook I released, I just had them do a bunch of that stuff because I know if they just did that, they'd feel a lot better because they're doing what the body's doing. It's getting them out of what they're so used to doing. So yes, it is all about the gait cycle and how you're kind of relating it to the exercise and position you're using. But ultimately, the gait cycle is just a representation of alternating expansion and compression.
Awesome. Thank you.
Connor,
What's up?
talking about alternate actions, can you go over again, if you are emphasizing the corrective part here, where do you want to breathe in and out and what's happening?
Depends where you want to shoot air. So this is, great question. So if whatever's concentric, air is not going to go there very easily. Whatever is eccentric, air is going to go there more easily. So if I have like a single leg stance cable press and I exhale when I'm in this position, my pec is concentric, so I'm not going to get air as much there.
If I'm pushing, but if I'm pulling, I can get air there.
Yes. So if I'm going to pull, and let's say I'm pulling with this hand, so I'm back here, I've got a lot of concentric activity on the back side, especially within my scapula, as those muscles are retracting my scapula and also downwardly rotating it. So all those muscles are going to be concentric. All this is going to be more eccentric. And then you've also got to think about what's going on the other side right here. So I'm going to be getting more anterior expansion with this reach right here as well. So this position, if I'm pulling, lots of stuff going here. And also probably below the level of the scapula a little bit.
Cool. And about the front foot elevated split squat, I was trying it and I felt a lot of like weight on my back leg. That's normal. It's how it is.
It is, yeah, but I also think it's with the front foot elevated split squat, I find I have to very much cue the intention to keep more weight on the front foot. Just because of the nature of the position, it's very easy to lean on the back foot. So I think it's almost a lack of trust at first for that person to lean over their front foot because they can leverage their back foot very easily because it's in a toe off position, right? So it makes sense they want to propel off of that leg. But if you have the foot on a book or a block or whatever, it's very much easier to find those like single leg stance muscles, for example, if you shift forward. Forward hip shift can be a good strategy if it's appropriate for the context that you're in. But also just, I think if we go back to, I think Rich brought it up, putting their back foot up against something can be a good way to get them to cue that push onto the front leg.
In a front foot elevated? Okay.
Mm-hmm.
Because I was trying it myself and I found like at the end of flexion, I would lean over my front leg. So it wasn't really hip flexion. I was like doing a trunk flexion. So if I want to be straight, then my weight goes to the back leg. So I was confused with that.
I don't think you need to be totally upright for that activity.
Okay.
Yeah, because you're exactly right. If you're getting trunk flexion and if I'm here, if I'm perfectly upright, I'm going down on my back leg. But if I lean forward, just have like a 10-degree incline, it's a lot easier. And I think if you cue that slight trunk incline, you're going to get a better result because you're also.
I can break 90 degrees in tibial flexion, dorsiflexion.
I think so. So. Yeah. If you're keeping a relatively upright tibia, then that's totally fine. Just like in the front heel elevated split squat, I go in a little bit of a positive shin angle at the very end, but it's relatively so much less than if I were to do, for example, a regular split squat or a rear foot.
Okay, cool. Thank you.
Mm-hmm.
Connor, so I did an assessment with my friend yesterday, and he's definitely a wide ISA. He's compressed. He has some secondary compensations, but the first thing is when I did his squat, he like failed miserably. He couldn't get to parallel. He like almost fell backwards. But he's messed up his ankles playing basketball a lot. So it's like when I look at that, I think that he's definitely compressed. I don't think he'd be able to squat like to the ground, but I also think that like I kind of got to clear up some of the ankle stuff before I could really get a true representation of what the assessment's telling me.
Yeah. I think you're using your common sense well there.
Okay. And then the other thing that I have the question about is if we have a wide ISA who should be naturally biased towards, what was it, IR extension and yeah. And but what happens if you do the assessment and then maybe like one shoulder the IRs or the ERs crappy, and then one hip the IRs crappy or whatever, like it seems like it's like these secondary compensations aren't uniform. So then like where how do you look at these layers if that's happening?
That's a good question. So I think in my experience, at least, I see that they almost always line up to the underlying left AIC pattern. So for example, if I've got a wide that's got secondary and they've got like no IR, their right 95% of the time is worse than their left. And then their left ER is 95 worse than their right. And that's just, how that goes. So I think I'm going to be thinking about how does this relate to the left AIC pattern? And then if it doesn't relate to the left AIC pattern, it's something on a left field, I'm going to unwind them bilaterally as much as I can and have them pass the phase 1 stuff. And if they still have like, wow, you've got crazy asymmetries, and I'm going to start thinking pelvic orientation at that point. Does that help?
Yeah, cool. And just when you say, I know we talked about this in the previous review session, but when you say clear bilaterally, could you just give me like a quick, like maybe an exercise or something, just so I have like a visualization?
Hook, lying, hamstring, bridge, 90-90 side plank, things like that. And basically when I say clear them bilaterally, I mean past phase 1. That's basically what I mean.
Hey, Connor, can you hear me? I have a question on the pelvic orientation stuff. So let's say you got them there and they, like you said, they're still showing some asymmetries and they have one of the pelvic orientations. How are you considering those and how do you go about treating those differently? Or are they all the same? Like you're still trying to just get them back to the left side, or like how is the sagittal treatment considerations different from lateral, et cetera?
Yeah, so in the corrective exercise week, I show like some of them are pushed to the left, some of them are pulled to the left.
Okay.
That's like the first step that you use. And here, I'm going to share my screen really quick. Oh, perfect. I actually have it up right now. All right. So here's the lateral sagittal orientation, pull back to the left first, then left hip shift stuff, and then dynamic split stance, and then lateral push back to the left. The only one that is push back to the left first is the lateral. The other two are pull back to the left.
Okay, so sagittal and oblique would be treat them similarly. Lateral would be more pulling. Okay.
Yeah, lateral's the push because you want to.
Oh, lateral is the push. Okay.
That's going to even out because the glute max inferior fibers are going to drive up, and then you can pull them back from there. Whereas the oblique and the sagittal is more just this, and the oblique is a little bit of a combination of both, but you still want to pull them back because it's not as dramatic as the lateral, which is up here.
Okay, thank you.
So
yeah, go ahead, Ben.
With my sagittal orientation, I mean, I wasn't too deep into it. We didn't really go after left hamstring as much as left adductor. What would be the specific application of both of those, and when would you maybe go after an adductor over a hamstring or vice versa?
Yeah, I think you could use both in combination. A good activity to do that, because you probably would want to do both at first. And a way you can do that is just hook line, ball between the knees, right here, tuck, or sorry, I messed that up. Push the right knee forward, pull the left knee back, and then you got medial hamstring, and you got adductor at the same time.
Gotcha.
That would be pretty ideal. But yeah, the adductor is, I find personally, the adductor is really, really important when it comes to these orientations. And that's why I like that left hip shift squat, because I find that it basically just hammers the adductor. And it also works it through a deeper range of motion than just an adductor pullback.
Gotcha.
Something else that I haven't actually put in these slides that I found is really important for people. And I'm talking people that are just locked up. And for example, someone who's got a lateral and they've been in it for a really, really long time is a posterior hip capsule stretch. And the left AFIR squat actually has that as part of it. Again, a reason why I really like it, because if you're here, you're trying to find right side internal rotation. So you're here and the left hip, if you started in a normal left AIC pattern, you're like this, right? So if you're here, and this is again such a dramatic exaggeration, you don't spend a lot of time getting back here within this hip. You really don't spend a lot of time here because you just can't. You're over here. This hip is flared out. So if you get this person to do like that left hip AFIR squat, and that's not like the only thing you should do. I just find it's a good bang for your buck activity. You're doing this. And look at what happens. You're stretching out. That's what you feel when you feel that deep stretch in your back left hip. This is what you're feeling. And people will say, well, why am I pushing my left hip up if I'm in this left AFIR squat or doing this stuff? You're not pushing it up, you're pushing it back. So just because it is up doesn't mean you're not driving it back like this, which is exactly what they're doing. So that left, I've had a couple of people tell me like this posterior hip capsule stretch has made them feel better than anything else they've ever tried. And I'm not going to say that's going to be the case with your clients every time, but I think in the right context, appreciating that this thing never moves back is important. What's up, man?
Can you hear me?
Yeah.
Okay. So I've tried lots of your. Sometimes I don't know if I have to feel something special, and maybe I have to make like assessment before and try resets and prep and routines of exercise. For example, especially for the weight room ones, because maybe it's so clear that I don't know if I'm doing it right. I look at the video, I take all this, I just feel okay, feels okay, but I don't know where I'm at, you know?
So
I
basically,
don't know if I'm the only one that
you're asking, like with the sensory motor stuff on the ground-based stuff, you know what to feel, you know how to find it. It's more straightforward than the weight room stuff where it's got load, so it's harder for you to find and feel the right things. And you're wondering like, am I doing this right? Because it's harder to find and feel those same things. Is that your question?
yes.
That is and this goes back to the idea that load is compressive. And every time, if you guys ever watch a Bill Hartman video, he will talk about, you need to, like for someone who's really messed up, they'll say, okay, you need to get rid of all the bilateral symmetrical stance activities because all that stuff is just going to compress you. And if you keep doing it, then you're probably not going to see as much success. And for a while there, I was like, yeah, but people really want to do that stuff. So is that right to take that away from them? And the more I work with people, the more I realize like he's kind of right. It's hard for people to get rid of that stuff, but also if you give like really so much of getting people back to a better spot is load management. So if you can take away the thing that's giving them the issues, it's like that classic thing. You go to a doctor and say, why does this hurt? Okay, stop doing that. That makes it hurt, you know? That's a big part of it. So I think load is inherent, and this is, sorry, a little bit of a tangent. So load is inherently compressive. So it's harder to feel the things that you're feeling in the exercises when you add load to them, because you have to compress more tissues and kick in more tissues in order for you to complete the movement effectively. So I think if you're really looking to get the adaptation and really looking to get the specific integration of the muscles and sense them, I would say just lower the weight. And that's something that's
Okay, so just focus on endurance force, so to say, or not like hypertrophy with medium and low loads, right?
Yeah. But at the same time, there's a double-edged sword, because in order to get a specific adaptation, if this is like a strength athlete or this is a bodybuilder, this is someone who really cares about their physique, doing 30% of their 1 rep max and trying to feel their right glute in a split squat position isn't going to be very conducive to their goal. Yeah. So I think there's got to be a balance, and I think we have to respect that people aren't here to just always move better. They're here to chase like a specific goal. And I think we've got to put that first before we start to like put our own, needs and wants above the client, if that makes sense. So I think the best way I've found is.
So
Go ahead.
For example, I love pull-ups. You know, I'm an ex-former gymnast and I do calisthenics, so I always do pull-ups. And I was like, okay, but what
Oh, I think we lost him. Yeah, he's gone. Okay. So now to wrap up that thought, I found the best way to do it is tertiary block stuff. You know, get their primaries, get their secondaries out of the way, and then throw this stuff in at the end. That usually is a good way to do it because they're usually pretty tired by that point anyway. And also integrate it within the warm up. Hey, you're back.
Yeah, back. So for example, I love pull-ups and I like to alternate the grips. So maybe I'm biasing, not always compressing myself, you know, because pull-up is compression. When you do up, you feel like you go into extension. That's what your body wants to do. So I try to tuck my knees up to me so that I'm not compressing myself on the back all the way.
Yeah. I like your thought process there, man. And I think you can, like, it's okay to do some stuff and not think about how much you're compressing yourself too. But if you're working with someone who's injured and you're working with someone who needs to rehabilitate themselves, then yeah, I think that would be a really good indication to consider. But if it's just, you know, the average person, then I would say, yeah, let them compress, because a lot of people compress for a very long time and have no issues.
Let them compress. Decompress, my friend. Okay. So that was my question. Okay, thank you very much. I have to go. I have a client waiting.
All right,
Okay.
man, thank you for being here.
Yeah, I try whenever I can.
All right, my friend.
See you guys.
See you later.
Bye.
All right. Any other questions?
I have one more question, if it's possible.
Go ahead, and then we'll
about the gait. So when we are using contralateral load in split squat, if we go for heel strike, that would be external rotation, but in mid stance we go for internal and we still do contralateral, but in late stance we do ipsilateral.
Mm-hmm.
So we have two ways to get external rotation or emphasize external rotation, but they are the opposite. So you told me the other day that you want to go back, like if someone is late, you want to meet, and then early. So I guess you want to go late when you have someone in early, or you don't want to go late, never.
So think about it like this. If I've got someone who's late, I'm going to bring them back to mid stance. I'm going to bring them back to heel strike. If I've got someone who's heel strike, then I need to push them to mid stance. Then I need to push them to late stance after that. If necessary, usually don't need to do that, because usually if you get them from early, if they're just a pure early, then they're probably not in deep compensations at that point. Because usually people that compensate push themselves forward because they can't do it through their normal biomechanics. So they're going to find a way to compensate to push further forward. The only time you see someone who's early, who's heavily compensatory, is like I don't know. I don't even think I've seen this. Like someone who's a wide with ridiculously high arches. You know, I've heard of those cases. I haven't worked with someone specifically like that yet, but I've heard people that have like real high arches, look like heel strike feet, but apparently they're just end game. So I don't think you'll have to worry about that. But if someone is early, they're probably primary. Push them to mid to give them some IR, and they're probably totally fine.
So if I have someone who I want to give them expansion, you would go to heel strike normally?
That would be...
It's confusing because the difference in degrees is very little between heel strike and mid stance. But you're using the same strategy in load.
Can you give me an example of what you mean?
So if let's say I'm doing a front foot elevated split squat or a normal split squat, and I'm using contralateral load, right? In one, I'm looking for external rotation, but in the other one is more internal rotation. But the difference, I find it like it's very, very subtle. Like, I don't know if it will make that much as a difference.
Yeah,
I don't know.
It probably wouldn't that much. I think it's more mid stance on that front foot elevated split squat. If you do a forward hip shift into it, then it becomes heavy mid stance. But just without the hip shift, it's pretty early stance. because you haven't really recruited the adductor to a meaningful extent, or the glute med, or any of those internal rotators. So I think if you want to bias early stance, just do a front heel or front foot without the hip shift. You want to bias mid stance, do the hip shift in a front foot elevated position or a rear foot elevated position. If you want to do late, just do rear foot elevated, ipsilateral load, and then just have at it. Or you can just do like a narrow stance split squat with an ipsilateral load without any elevation. And that would also be late stance because of the shin angle.
And looking for that, I found one of your videos where you are talking about the arch, and you are giving an exercise where you have your toes your toes elevated, but not like like holding that elevation. You know what I mean?
Oh, like a heel float split squat?
I don't know the name. I don't know the exercise, but
It's like
sure.
Like this sort of thing.
Mm-hmm, exactly.
That, yeah. That
Here, what's your goal? Like, you are still in heel strike, even if
I would call that late stance. And the reason for that is because you're getting resupination of the foot and the weight is on the ball of the big toe.
That was like what confused me, because if we normally want to go back, in most of the clients, even if they are overpronated and I want to regain some arch, I would go to put heel strike or that option you just gave us.
I would push them more to heel strike. If I had someone who I just got, let's say I got this person today, and I'm like, what do I do with you now? I'm going to push them towards heel strike. I'm going to worry about that stuff down the line once they regain their biomechanics, but I want them to just be able to access external rotation effectively first.
Okay. Okay, thank you.
Mm-hmm. Did you have a question? Yeah, go ahead.
Hi. I would like to ask, like, if people, like, some people find it really hard to feel like they are AFIR, and what are some of the good cues to help them, or some of the really basic exercise to help them? Because I saw them like falling back to ER again.
Mm-hmm. Yeah, that's a great question. I think if I want someone to feel AFIR, which is the acetabulum moving over the femur in this instance, the best way to help them find and feel that at first is do that left hip shift squat without the squat. So just have them place their left foot on a book, right foot out in front, push the left hip back, and then they should feel that posterior hip capsule stretch. That right there is just a good way to get them to sense what it feels like for their left hip to go back, and just hold that. Another way you could do it is you could put a band. I think I have one actually. You can strap a band around their knee and have them, have the band pull their leg outward. And then I would just say, don't lose that adductor. Don't let this band pull your knee outward. And then they're going to have no choice but to find that AFIR. Because if they didn't, they would just have this band pull them out and they're going to fall back into ER. So that's a really good unconscious reference you can use. And also, you can also just do deadlifts in a split stance. That's a little bit more of an advanced way to do it, but you can just do like a same side load, rear toe elevated, and then just push back. You guys can't really see that, but you get the point. Because of the toe elevation, you're biasing mid stance IR, and they're gonna have to be in AFIR on this side. Those are a couple of things I would do if someone's struggling.
Thank you. And one more question, if that's all right.
Yeah.
I have a client who's stuck at a late stance, but she's very weak. So we should have brought her back to mid stance first, right? I tried to give her like the squat with a foam roller between her knees and bring her to like 90 degree, but she had her feet, like she tried to rotate outward and back to late stance again. So I'm kind of confused.
Mm-hmm. Yeah, that it sounds like she is one of those people that just likes to live on their toes. So I would say if that's the case, let me ask you this: what does her body weight squat look like without the roller or ball between the knees?
She's kind of stuck and wobbly, and she's still kind of weak because she just started training as well.
I see. Yeah. I would say get her squat pattern to look pretty good with like a heel elevation and try it with that first, and then try to add that in. And I would go for more of the mid stance mechanics with more split squat like activities and also more of the single leg deadlift activities. I think if you biased it with that, you'd have a lot of success instead of a bilateral.
I actually tried with the single leg activity, but her knees just like fell inward and she's pretty weak. So I'm kind of confused of how to handle the whole situation.
Yeah, it sounds like this person just needs to get generally in shape, because it sounds like she doesn't have, this is a very common thing you see with people who are just, they don't have the body awareness yet to do these things and own the positions. So I would just say, don't worry about any sort of toe elevation, heel elevation, anything like that. Just get them to have the competency to own the positions, and then you can start to introduce those things. But if they're just untrained and they don't have the capacity to do just a normal split squat, then they're certainly not going to be able to do it with any sort of elevation. So I'd say get that person just like, 4 weeks of just generally like GPP, general physical preparedness, and then just, take them from there. And I'm glad you brought that up, because that is a really good point. If someone can't even get into these positions, then they're probably not going to have very much success. So do a lot of ground-based stuff, like get them on the ground and get them a lot of references, and do some of that stuff from week 6, the corrective exercise week. That gives you the adaptation you're looking for. That's going to be better than just getting them upright.
Okay, thank you.
Mm-hmm.
Okay, so sorry, I jump in there. I'm like such an asshole. I apologize. But okay, so I have something to add on to that. With the forward hip shift, my experience is not getting them into the hip shift, is to do the forward hip shift. It's more exaggerated. It's an exaggerated forward hip shift, and they pop that, and they pop that like that front that hip, that the loaded like hip out. I'm just like, no, that's too much. It's more subtle. But they're like, but you said to shift your hips. So yes, so I defer to you. Yeah, no, I think the cue I will always default to, I've said it a billion times, is just, I will have them in the split stance. I will just say, okay, push your back knee back, and pull your back knee back and push your back. I messed that up. I'm so sorry. Let me restart. Okay. I've said this so many times, you think I'd have it, right? Pull your front knee back and push your back knee forward. And then they should feel their adductor, their glute med. If they have it, then that's perfect. I already have them right here and I haven't done anything. That's all it took. So I'm just gonna have them back down and do it like that. And if they're really struggling, we can go back to what Rich said earlier, put their foot on a wall, do it like that, even easier. So I think just getting them to relearn what it is without, doing one of those funky hip shifts like you see, because if you do that, you're just going to block your ability to move, because you're just going to be so basic. You're not even going to be in your hip. You're just going to be leaning outside of it at that point. Thank you so much. You're welcome.
Can I ask a question?
Yeah.
In one of your other weeks, you talked about that one foot could be supinated and the other one is pronated, and that is very common. You talk about that one foot is pushing toward the other, and yeah, like all the other, I guess I couldn't wrap my head around it. Can you is the supination pushing into the pronated, or is it the pronating foot that is pushing into the supinating, and what is happening above around the pelvis?
For sure. Think about the left AIC pattern. What is pronation? Pronation is pushing, right? That is I am basically going into internal rotation, so I can then begin the process of transferring my body weight from one side to the other. And then supination is I have accepted that load, or I have begun the process of accepting that load into one side of my body weight. In the left AIC pattern, you've got a pronated left foot and a supinated right, because I'm pushing out of the left and accepting that weight into my right. If we saw the opposite, that would be an indication this person probably has a lateral orientation and they're probably pushing out of their right because they've been in their right for so long that right is like, I've had enough of this. And then you try to push, right foot becomes more pronated, left becomes more relatively supinated. But in that case, you're probably going to see a pronated foot on both sides. It's just the relative amount is going to be higher on the left. But basically the pronated side is pushing into the supinated side. Mm-hmm.
Thanks.
Last call on Monday, you went over, I forget, it might have been Ben, you did like a 3-step approach for clearing up some of the stuff in his assessment. And I was just kind of like, I'm wondering if there's like a formula per se that you use, because you said a 3-step. I don't know if they were just like saying that for that moment, because what I'm finding is I'm at the place now where like I've got so many more things that I'm seeing with my assessment and it can be confusing. So I'm trying not to let it overwhelm me. But then I'll put someone in a position and I'll see like a really good result. And then I'm like, okay, but why did that happen? And what do I need to do now to lock it in? Because I personally, like, I don't really think that five breaths and that's it is gonna really like seal the deal for an athlete or someone who like trains a lot. So I just wonder what, like, if there's a formula, I'd like to kind of hear it.
For sure. Yeah. So it's obviously the formula depending on what, but I know you don't want to hear that. So I'm going to give you I'm going to give you something else. So let's take Ben, for example. Ben, regardless of any of these pelvic orientations, which is when we start to see the crazy stuff, like the people that we don't really fully understand, those people are still trying to get in their right hip and out of their left. So regardless of where they're coming from, that's still the issue, the underlying cause. So if I got that person, like let's say Ben's feeling good, he didn't feel that pinch in his hip, everything's fine and dandy. I'm going to then put him in single leg stance activities that are reflective of what I want him to then own. So in that, let's say that left hip shift squat, we got him to feel that AFIR and he owned it and his adductors lit up. Now I'm going to put him in a split squat position that's going to give him the outcome that I want. I'm going to have him own that. So that would be his warm up. But then throughout the training session, I need him to like load that position and own it. And then on the right side, something like a rear foot elevated split squat with an ipsilateral load is going to be ideal. So that's going to help him push out of the right and get into the left. There would be instances where I have him do just a Camporini style deadlift on his left side and not his right. But it's just, so I would say, to give you the formula, do all that stuff in the warm up, those ground-based positions, and then pick the split squat, the lateral lunge, the deadlift style activities you want for them to then own those positions with load. Because you're right, if they're an athlete, that little 5 breaths on the ground is not going to be enough for them to, deal with the demands they're placing on their body in sport.
Okay, thank you. Yeah, that helps with the, like, just thinking of all the variations from the split squats, lateral lunges, and single leg work.
For sure.
Thanks.
If I'm ever on the fence of something, if you guys want to restore internal rotation, front foot elevated split squat, forward hip shift. If you want to get someone to get into their hip, do something like that. Or a Camporini rear toes elevated, same side load. If you want them to get, or contralateral load would also work. If you want them to get out of their hip, then rear foot elevated, same side load split squat. Or you could do something like, I don't know, you could do like a lateral lunge with an ipsilateral load. And then you can have them drive out that way. If you did a contralateral load, that would help them shift into that side more.
Okay, and then for an upper body example, so like with the rib hump, I've been doing like the inverted quadruped with elbow on a book, the side that doesn't have the rib hump. And okay, so then after that, would it be like turn them on their back and have them do like a single arm, like a chest press with like an extra little bit of protraction? Or was that kind of like the right line of thinking, or would you do something different?
So like, let's say they had a rib hump on their right side, which is what you see more often than the left. What I would do is, yes, book underneath left hand for sure. Great way to go and start off there. But we'd also want some left posterior expansion. So I might do, for example, one of those cable chops, just going to the left side, spine's going right, expand the left, boom. And then you're compressing the right, relatively speaking, which is good. And that's what we're looking for. If I was going to do a single arm press variation of that, what I would probably do is a right press, because that would help me push. And then that would help me get out of my right side, expand the right anterior. Now I would probably do I would still do a push in that case. That would help me push over to the left side. If I want to do a row variation of that, I would probably do a row here and then a low reach here with the left arm to get left posterior expansion, right anterior expansion.
Okay, and then how does the right rib hump that's common correlate to the left AIC or the right BC pattern? Assuming it does.
Yeah, the right scap, remember the right shoulder is being pulled forward. So the right scap goes into that winged state like this, which allows for that relatively more amount of posterior expansion to occur on the right posterior rib cage. And then you're in that left trunk rotation. So the left scap gets pulled back and then it's blocking that posterior expansion from happening.
All right, thank you.
Mm-hmm. You guys want to go over the study guide at all? Okay,
Yeah, I have one more
let's do that. Oh, go ahead. Yes, please.
So I have, it's not something crazy, but I have a client who's a narrow ISA and she's in a primary compensatory pattern. And I tried to put her in an all-four breathing pattern to get some anterior expansion, right? But what I saw is like a lot of the air is going back to the posterior and the scapula is winging upward. What would you do in this situation?
Yes. Okay. So good question. With all four breathing, people will often over round. And I don't think this is something that, is very apparent at first, but if you're in this all four position, and if you do this, look at what happens to my sternum. My sternum's depressed. I can't get any air here. So I cue a very neutral spine with all four breathing. This is all I'm looking for. I'm here, unlocked, tuck. This is all I want. Because now if I come up, my sternum's open. Whatever's down, I'm going to concentrically orient all this crap, and then I'm not getting air here. So if you're going for prone, and I'm so glad you brought this up because this is a great point. If you're prone and you're collapsed in your sternum, you're getting nothing there. So it's very important to cue a nice neutral thoracic spine. That does mean a slight degree of retraction, but it's not what you see in like the PRI books a lot of times. You do this sort of thing. I don't fully understand that.
That's really helpful. Thank you so much.
Of course. All right. So I got the study guide pulled up here. And let's go over it. Okay. Number one, pick three progressions for a both bilateral and unilateral push. So squat, split squat. That would be suitable for a wide ISA with secondary compensations. Assume after the first progression, you've gotten them to the point where they've recaptured their external rotation. Now you're seeking to get more internal rotation.
So go for a goblet squat, circus squat, front squat, 90 degrees with ball between the knees.
Yeah, you could. Yeah, I think the goblet squat, heels elevated, maybe a band around the knees at first would be a good way to go, or that Zercher squat. That would be a good first progression.
With the band around your knees. So if we're looking for IR, though, it'll be ball between the knees, right?
Yes, assume after the first progression. So I'm saying like step one would be the goblet squat, heels elevated, band around the knees. For step two, when you want to recapture IR, that would be an appropriate strategy, what you said, Rich.
Right. Okay. Sorry, I've gone for the three things that would give, like going easier to hard on to give IR. Okay, cool. Makes sense.
Yeah, cool. Okay. And then we also got to think like, okay, well, now we probably need to load them heavier. and also challenge them a little bit. So for the third progression, what would you probably want to do if this individual has recaptured both ER and IR? Have them lift, right? Do whatever. What's their goal? Chase it. Okay, pick 3 progressions. Go ahead.
In this one, for a client, I don't know how it would be like, okay, I'm starting with doing a full squat and then I will just keep you to 90 degrees. It looked like a regression.
Mm-hmm.
So it's kind of, I don't know how we would explain that to the client. Like, okay, now we are doing less range of motion.
That's a really good question. So you probably wouldn't do that, right? You probably would just do either a ball between the knees and not have the box and you'd still get a fine outcome. Or you just don't do a bilateral squat with a ball between the knees and you just worry about the unilateral stuff taking care of that.
Okay.
Mm-hmm. Yeah, that's why I like these questions, is because they're just like, so, like it's like real life. What do you do? Because there's so many choices. Pick 3 progressions for a unilateral lower pull that would be likely suitable for a narrow ISA with secondary compensations. Assume after the first progression, you've restored ER and now, so it's kind of like the same thing as the last question, but only unilateral lower pull. So narrow ISA, secondary compensations, they've lost their ER bias. They've picked up a little bit of IR, but it's in a compensatory manner. They're in an anterior pelvic orientation. What would be a good first unilateral lower pull? There's several answers you could pick here, none of which are wrong. There's really no wrong answers.
Well, in that case, if there's no wrong answers, then
Yeah.
I propose toes elevated contralateral load Camporini style deadlift,
Yeah.
as well as put the band around the inside of the knee on front foot elevated split squats.
Yeah. So this is, yes, I wanted to talk to you guys about this one in particular, because this is, well, there's 2 schools of thought. Number one, that narrows suck at hinging a lot of the time. They're not very good at it because they're going to round their backs. But usually, like, let's say this person has competency in hinging and that's not a problem for us, in which case, Amy, I would pick yours as the first one if they had no competency hinging whatsoever. If they did have competency hinging, what I would probably do is a back heel elevated. So I would be here, like so, and I would probably choose maybe a contralateral load or a bilateral load if it's a primary, and just have them go down and then come up. That's going to help them decompress some of the tissues that they have going on. Specifically, their hamstrings are probably really, really tight, but because they're in a lengthened position, not a shortened one. So I'd probably pick that back heel. But if they're in a toe off position, Amy, if they were in a genuine bunion situation, I'd probably want to bring them back to mid stance, and I would pick yours. And that would also help them recapture some IR. And what would be a good progression from the one Amy described?
Load it more and put like a trap bar.
Yes, that's where my head was going too. Do the same thing just with a trap bar, right? Yeah. Okay. Your client is a wide ISA powerlifter with secondary compensations who demands they overhead press within 2 months so they can improve their bench for competition. If you don't, they're going to find someone else who will. Since you have 2 months, you have 2 4-week phases. Pick 2 correctives for each phase and a progression for upper vertical pushing that would be suitable. This is their assessment. This is a loaded question, but this is also a real life scenario. We can say like, well, you're not going to overhead press. They're going to be like, great, I'm going to go pay someone else. And then that's just how it's going to go. Or you can do your best with limited options, because in real life, not everything is perfect. So let's do the first 4-week phase first. Let's break this down. Let's look at their assessment. They don't have an ogres. Their squat is pretty typical of a power lifter. Their toe touch is mid shin. Their active knee to chest is pretty typical for a power lifter. Their straight leg raise is okay, pretty good. Femoral IR is pretty limited. Femoral ER is very limited, less so on the right. IR is what you would expect. ER is what you would expect. HG adduction is okay. Abduction is not great. Flexion is what you would expect for secondary compensations. So give me 2 basic correctives for this person for the first phase. And remember, this person's goal is to overhead press. So what do they need to overhead press effectively? They need posterior expansion for sure, especially with that 90 degrees of limited flexion. So that's where my head's going. How can I get this individual to get posterior expansion? And how can I bring their pelvis out of this anterior orientation that it is in?
Lat stretch in a rock back position.
Yes.
And maybe also side lying tilts.
Yeah. I think that would be, if you're thinking about a power lifter, that might be a little bit boring for them, but that would be that's the right choice, Raul. Just like I'm thinking of what a power lifter would want to do. What do you think?
So probably I would go with a squat and bands with a band around the knees.
You could do that for sure. Yeah.
But if our first goal is to restore orientation, so these activities are targeting other stuff, but also orientation. But do we want to do a previous step to that, or that's okay, and we will just work orientation during the process?
If you're giving them posterior expansion, you are restoring their orientation.
Okay.
Because remember, like that way, air's not always going forward, so their pelvis is going to reorient if you give them posterior expansion. I would also give this guy a lot of hamstrings. So maybe like a foam roller bridge with a low reach to also bias posterior expansion. And that they like that too, because it burns their hamstrings, makes them feel like they're doing something. And also, I think you made a really good choice with that rock back lat stretch. What's that?
Is that the same exercise as like hook lying?
Yes.
Or not? It's the same?
Same. Mm-hmm. And then a rock back lat stretch would be another great choice. Another choice to use is like that banded chop. All right, let's pick. Okay, give me now a vertical push for this person. Remember, shoulder flexion is 90 degrees. Let's say for the purposes of this example, in the warm-ups, you got his shoulder flexion to 120. It improved to that. So now you have that range to work with this individual.
You could just use a landmine.
For sure. That would be my choice too. What kind of a landmine? What position would he be in?
Like a low seated.
Yeah. Okay. Let's go to phase 2. Let's give him 2 more correctives. So now let's say, for the purposes of this example, we've got 120 degrees of shoulder flexion on each side. He's recaptured some of that pelvic position, and he also has his ER back for the most part. So what are we looking for a corrective for this phase? Remember, if you're compressed at 120 degrees of shoulder flexion, you have compression between your scaps. So that's now his limiting factor rather than below the level of the scapula. So he might also have some compression in his anterior rib cage too. So if I wanted to drive air in between the scaps, what would be a corrective to do that?
You could do like a 120-ish degree hang. So you could also get some anterior expansion going with that too.
Yeah.
With like a leg support or something.
Mm-hmm.
Supinated.
Yes, sir. Yes, sir. I don't expect you guys to watch every video I put out, but I've put one out on that Searcher one, where you're turning into the same side and getting that stretch in between the shoulder blades. That would be a very appropriate choice. That preacher curl, respiratory preacher curl would be another good choice.
I have a question. When Tyler said the 120 degree hanging with like leg support, is that lazy sloth position? Do you know what I'm talking about? No?
Oh, Ben, I think that was a question for you.
What did you call it? A lazy what?
Lazy sloth. Sean Lai calls it lazy sloth, like where you're just like hanging, like your legs are on the ground and you're hanging here. And is that what?
Yeah,
No.
what I like to do is put like put a barbell like at a higher rack height and then prop your heels up on like a bench so you can also get some hamstrings and some posterior tilt going.
Okay.
And then you're reaching at the angle that you have enough shoulder flexion to authentically do. So
Okay.
you don't have to hang like this, because a lot of people just start to get pain when they're reaching more than they can actually flex.
Right. Okay. All right. So it's like a version of lazy sloth. Okay.
Yeah.
Oh.
It's a good one. Okay, now if we were going to progress that short-seated vertical landmine press, he's got, let's say we got him to about 160 degrees, 150 degrees of shoulder flexion. How would you progress that vertical push? Obviously, we can't quite barbell bench press or barbell overhead press quite yet, but what would we do where we could load him up even more?
You could just do a high incline barbell.
Yeah, for sure. For sure. Another thing my mind goes to, what do you call that attachment that you can put on a landmine where it's like two handles?
A Viking press?
Viking press. That's what I was thinking. Yeah. I want one of those things. Those are badass. All right, let's go to the next one. Take the assessment from last week's study guide, a narrow ISA with a history of moderate to severe right ankle sprains, and design a full body training session. We probably don't have time to do this, but let's just pick a couple of movements for this individual. So right ankle sprains. So they can't really they don't trust that right side as much. Squatted 100, toe touch a palm on the floor. Active knee to chest is way better on the left or the right if you'll pinch in the right hip flexor. We had this same assessment last week when we determined they are what?
Sagittal.
Why? What makes you say sagittal?
Well, the right hip flexor pinch and the straight leg raise being better on the left than the right.
Mm-hmm. Yeah. And their shoulder flexion is better on the left than the right too. That's another big tell. Yeah. Okay. So if we've got this orientation issue, we haven't talked about this yet. How do you weight train? Well, we kind of did earlier today. How do you train someone who has an orientation issue? Well, kind of like what I touched on, what I would do with Ben is I would get them to do all those correctives, all the stuff we've already addressed. And then I would seek to restore their, because this person's goal is to move better. It's not to lift a bunch of weight. So if we wanted to restore that, we would probably think about doing those split squat variations that we talked about earlier. So this person has a moderate to severe right ankle sprain. Usually most ankle sprains are lateral. So let's just say this person's pretty supinated on that right side. I would probably get them to send some pronation on that right side. So I might do like a rear toe elevated Camperini style deadlift on the right side and the left side. Because that right side still needs IR. We can't forget about that. And on a split squat variation, what might we do?
Front toe elevated with split squat. You're talking about for the right leg?
Yeah.
To get more pronation, to get them to sense it, because they just don't want to pronate.
I like that a lot. Yes. Yes. And what about the left side?
Could you just do like a hip shift on the left side to get them back into the left side more? Because they're always kind of left side forward, so you want to bring it back.
Yeah. Nice. Okay. Here's a question. What about an upper push with a cable? What would you want to do there? I would want to get that cable to help them. I literally said it earlier. Push them out of their right.
Push on the right.
Cable press on the right with the right foot forward.
Mm-hmm.
Would be good. What about a row? Cable row variation. Another cable push you could do is a half kneeling, drop the hip, get that hip shift there, and then a right cable press like that. That's another thing you could do. Okay, now let's talk row.
But in the press, you said right leg forward.
In a split stance position, yes.
But in the half kneeling is left.
Because you're hip shifting into the left. Does that make sense?
Wouldn't you want that also in the split stance?
You could, but I like the idea of the up here driving out of the right like so with the press, whereas here you can drop the left hip to recapture some IR, especially 90 degrees of hip flexion, whereas you don't have that ability if you're in a split stance because you're not going to get as much concentric adductor. Whereas if you drop them down here, you would. Lots of things to consider, I know. But just to keep it simple, you could do, to go back to your point, Raul, you could just do a split stance again. You could just do a split stance cable row with the left side, right arm reach like so. Or you could do a half kneeling version of the same thing. Those would all be good choices. It's just where you're trying to get the pelvis. Think about where the pelvis needs to be, and then your exercise selection becomes a lot easier.
And actually about this orientation stuff, with Ben, you did the arms bar, right? And when I was...
Say that one more time?
The arms bar exercise?
Arm bar, yeah.
But in the slides, it says same side, but then in YouTube, it says cross. So I was confusing if it's the same exercise or you can do it both ways.
Oh, you mean the cross connect arm bar?
Yes. Is it the same or are two different exercises?
It is the same, yeah. And the cross connect same side arm bar, I'm just talking about that right here.
Mm-hmm.
Yeah.
But it's the same exercise.
Same exercise.
And then you want the right leg on extension and left leg in hip flexion?
Oh, I see what we're talking about now. So the same side connect arm bar and the cross, and when I say that's actually so poorly named, I should probably fix that. Right here, this is one drill, right? Mm-hmm. This is technically, you could do this for the orientation. That's totally fine. Honestly, it would be just perfectly fine. But what the other one is this right here. Left hip's at 90 to bias that nutation to the left side. And then the right hip is driving into that wall. You're gonna get a little bit of right glute max, and you're gonna reach right here for the right arm reach to push you to the left. That
without the shoulder extension.
You could very well do this. You could, and it would be fine. But the reason why this is included is because this is biasing more hip flexion. This is trying to maximize the hip flexion where you meet in the middle here to get the posterior expansion. It's a little bit different, but honestly, you would probably be fine doing that.
Because the video, you are on the opposite side. You are on left extension, right hip flexion. So I was confused also.
I think that was just the angle I could get for the video. Yeah.
Cool.
All right. I gotta let you guys go now. I actually realized I went super over here. So I got another call, but thank you guys for coming. This was awesome. And I appreciate your guys' questions as always. Next Monday will be a little bit of core and some explosive stuff, which should be fun.
Thanks, Connor.
Thank
See you later.
you.